So we, just to go back a little bit, the context was there's a market in India. Well, first I'd say the Indian market structure requires products and services at a certain price that work for everybody. And for our portfolio in general, that meant, hey, we need to rethink a number of our products in a fundamental engineering way, design way. It wasn't about sort of taking a feature or two off a product. You really had to start bottoms up, if you will, market back with the customers. So we spent, this is going back to 2009, probably 5, 6 years ago, a lot of time with customers, developing product ideas with them, developing features, working on price points, that they said would work for them. And so now I think we have about 24 products, across that line. It's a range of our product line. Order of magnitude, I'd say we're probably, about 25% there. So when we think of the fruition of that whole program would be like 3 or 4 times bigger than it is now in terms of products. And I'd say we're experimenting right now, but trying to take that global. So it has big application in other emerging markets, but I think it also has definite application in U.S. and in developed markets, U.S., Europe. So we don't have a specific number in mind other than when I sit here today, I think our total sales are around 300 million of that globally. In my head, I think of a number like 2 billion or something. Is like, until we're somewhere around there, we should feel like we're not. But again, that's going to be a mix of the product design, development. I think many of them would manufacture here or, China. We finance and lease around the world, so through GE Capital. Yeah, we don't really finance through our industrial company, so we do that through GE Capital. But I'd say in equal part, probably greater part, we often arrange financing. So in a lot of countries, we might not operate GE Capital. So if we don't provide it ourselves, we try to arrange it. So again, getting back to this market creation thing, a lot of times in these markets, the need's obvious. Bringing the financing together is often as important as. But the public-private partnership, I think, is part of an answer to your question around accessibility. So that's something, we have done some of, would like to do more of. That's a global thing. I wouldn't say that's an India thing. But it's a path you have to pursue. I mean, there's always a path in the private market. There's always going to be investments there. There's going to be plenty to do there. But in many, many countries, this is such a core issue for all sorts of, reasons. Governments want to accelerate the provision of healthcare, and so some of that's going to come private sector, some of it's going to come from the government, and the governments don't really have the capability to do much other than help finance it. They can't operate the it's not that easy to do some of these things. So we'd be interested in doing more here. I would say broadly in China, we would have a more robust non-GE supply chain. So in some of our manufacturing here, we're still importing a lot of the component parts and things. If a lot of those are coming out of the US, the currency thing starts to kick you the other way in terms of that. But I'd say broadly, India can be extremely competitive with China. And it's a country we know well and are comfortable in. But the supply chain, broader supply chain would help accelerate the industry, I think, the manufacturing industry. Well, I would say, not much has changed. So the big disease states are, oncology, cardiology, diabetes-related things. We're more in cardiology, oncology. We've always been big in sort of maternal, infant care.